do Dr. Bai's paper on the 48-month 1 and 2 level disc replacement study.
That was wrong.
No. It's the fine print. This happens when you get older.
All right, thank you very much. I'd also like to thank my co-authors and all the investigational sites that participated in this data collection. Here are my disclosures, as well as the other co-authors. Okay, so looking at the background, really it's looking at, I think what's unique about the study is really looking at 1 and 2 level artificial disc versus 1 and 2 level fusion. It's the first study that really looks at a prospective manner comparing multi-level artificial disc and multi-level fusion. So the objective really is to investigate that, the 48-month or 4-year safety and effectiveness of 1 level versus 2 level cervical TDR, as well as 1 level, 2 level cervical fusion, and providing comparative data that we don't have available currently in the literature. So this is the study design. It's prospective randomized. This was the IDE trial. The data is taken from the IDE trial for the Mobi-C device, 1 and 2 level, comparing 1 and 2 level fusions, 24 sites across the U.S. Outcome measures were collected from baseline and regular intervals all the way till 4 years. Now the patient sample, so we have 245 patients enrolled in the 1 level arm. Okay, 2-to-1 randomization favoring TDR, 330 patients in the 2-level arm. So it's 2-level ACDF versus 2-level total disc replacement. 2-to-1 randomization, again, favoring TDR. All patients, again, had symptomatic arm or neck pain. And if you look at our follow-up rate for the TDR patients, we had 86.7% follow-up at 4 years, and for the fusion patients, 79%. The outcome measures are pretty standard across all disc replacement studies. You can see them listed, but the primary measures were Neck Disability Index, VAS for neck and arm pain. We did look at reoperation rates as well. And so I'm going to present this slide and go over that. And you're going to see through successive slides, because we have a lot of data, a similar trend. Okay, so right now what we have is we've got 1 level in the first bar or the first column, 1 level TDR, then it goes 2 level TDR, 1 level ACDF, and then 2 level ACDF. And this will be consistent for all the slides. And what you can see as we get out to 36 months, 3 years, and 4 years, that 1 level TDR, 2 level TDR, and 1 level ACDF are not really that dissimilar. Okay? However, we do see a significant difference in the 2 level fusion group, all right, in the NDI at 3 and 4 years. So it's the idea is, hey, is there any difference between a 1 level fusion or a 2 level fusion? Does it really matter if you fuse 1 level? Because we see a lot of disc replacement studies showing when we do 1 level comparative trials that we may not see much difference, although the midterm studies are showing that at least the adjacent level problems seem to be kind of coming out, that maybe disc replacements are somewhat protective. But here at 4 years, we do see that maybe a 2-level fusion is a different operation. So again, VAS for neck pain, similar schematics, 1 level TDR, 2 level TDR, 1 level fusion, and 2 level fusion. And we do not see a significant difference, but you do observe a similar trend. VAS for arm pain, this is the right arm, left arm, symptomatic arm. And again, when you look across the columns, again, I think you do see a similar trend, especially at 48 months. Now, the reoperation rate at 4 years, between 1 level and 2 level TDR, it really seems like there's no increase in reoperations. However, when you look at the difference between 1 level fusion, there is about a 3-fold difference from the TDR group. And when you look at 1 level fusion versus 2 level fusion, the reoperation rate does increase. These are adverse events. These are called major complications. And what this means is adverse events related to the device. So a clinical events committee that was completely independent looked at all the adverse events and said, okay, the ones that were related to the device are scored here. And again, between 1 and 2 level TDR, you don't really see a difference in the adverse events that are related to the device. However, when you start looking at 1 and 2 level fusion, you do see about a 2-fold increase. Okay? So maybe 2 level fusion is a different operation. Segmental range of motion, as you would expect, the TDR maintains its segmental range of motion where the ACDF is doing what it's supposed to do, it's fusing. both in flexion extension and lateral bending. Here's patient satisfaction. Okay, so a little bit of reverse. So the lower bar, you're less satisfied. Again, not dissimilar. There's no statistically significant difference here, but you do see a similar trend that you saw in all the other previous slides, where the two-level fusion patients may not be as satisfied. Okay. Again, would you recommend this surgery to someone else? Again, a very similar appearance. Okay. Here's the SF-12 mental component score. Okay, I would say these are all not dissimilar. And the physical component score, again, you see a significant difference in the two-level fusion group versus the one-level fusion group. And when you compare one-level TDR versus two-level TDR, I would say that they are not dissimilar and not dissimilar to the one-level fusion. But it's just the two-level fusion that seems to stick out. So our conclusion, I think the study suggests that ACDF as well as TDR is a good operation from baseline. I mean, all these patients had significant improvement. It does look like, however, that there is a difference that we see in the sense that one-level and two-level, multi-level TDR, their efficacy is about the same. Its efficacy is about the same with a one-level fusion, okay, regardless of reoperation rates. But it does see that we see a significant difference in the NDI with the two-level fusion. So all good operations, but maybe a two-level fusion is not ideal, okay, or maybe could be improved upon. So it's the idea is one-level fusion okay, but as you progress with multi-level fusions, well, is it going to make a bigger difference if you could preserve motion? Thank you very much.